Hi, I'm Krista Chase, Director of Regional Economic Development with Growing Greater Miramichi. And I wanted to share with you today some initiatives we've been working on in one of our priority sectors, healthcare. Today, I wanted to take you through the Greater Miramichi Service Commission's offering in healthcare. Growing Greater Miramichi is a part of the Greater Miramichi Service Commission. I'd like to tell you a little bit today about who we are, our mandate, the activities we're doing in community promotion, welcome and integration, promotion of regional career growth opportunities, and updates on the achievements and milestones. The Greater Miramichi Service Commission is made up of several departments. The department that I work in is Growing Greater Miramichi. We also have departments such as eco-diversion, which deals with recycling, composting, and waste diversion, among other things. We have community development, which also encompasses things like food security and transportation. Development services, which you'll be familiar with planning or building permits. And we have our housing authority, who is working on creating housing for all in the Miramichi region. Would you look at that beautiful region? This is the Greater Miramichi region. It is made up of all of the best places you can imagine: Upper Miramichi, Doketown, Miramichi River Valley, the Greater Miramichi Rural District, the City of Miramichi, Alnwick, and 3 First Nations: Metapanaghiag, Natawaganeg, and Escanobinich. This is the region we represent and provide services throughout, and in my opinion, the best place on earth to live. And this is the team. It's made up of myself, Director of Regional Economic Development, Krista Chase, and I'm supported by 2 staff members, Stephanie Tundu and Harley Ann Siddle. Stephanie's position is a Community Onboarding Coordinator. She leads most initiatives that fall under the Population Growth Strategy, which might include the concierge for the region for anybody who wants to find out information about our communities, where resources are, how they can be connected to people, places, things. Stephanie is leading that strategy. Harley Ann is Workforce and Business Environment Growth Officer. She is predominantly leading the workforce development strategy and also will be conducting our incubators for our priority industries, as well as a number of other initiatives which predominantly target our business community. Our mandate is to attract and retain population to the Greater Miramichi region while promoting economic development and strategic investment throughout the Greater Miramichi. We do that through collaborating with our strategic partners, and the actions we take are to promote the region as a great place to live and work. Our priority sectors are healthcare, construction, childcare, and agriculture. So now, jumping into the topic at hand, our initiatives in healthcare. I'll take you through a number of the things we've been doing since September 2023 to arrive at the place we are now, October 2024. So, as previously mentioned, one of our responsibilities is promoting our region as a great place to live and work. To do so, in the healthcare sector, we've been focusing on a number of things: creating community promotion materials, kind of unifying the messaging that we're going out to the world with all of the partners that we have, speaking to kind of the healthcare world on behalf of the region, creating images, professional quality images, a community sell sheet, brochures, materials, booths, displays, all of those things. Video asset production, we did invest in some creation of video assets that we can then use to promote the region in different media campaigns, as well as to use on those previously mentioned partners' websites, their social media platforms, or perhaps in any trade show advertising they're doing. We also, as I just said, will now be able to use those assets in a media campaign in a combination with those video assets and promotional materials. We do have a promotion where we have a vacation giveaway for healthcare professionals. When they attend these recruitment events, they can enter their name into a draw to come to the Miramichi region. And strategically, we will have them stay in a variety of accommodations throughout the region, doing different activities that are offered to them to have in their agenda so that they can get a taste for all of the different areas in the region and what life may look like here, coming and experiencing it firsthand. We also will have a healthcare professionals featured section on our regional living website. We're working on having a place on the internet where somebody can come and find all of the great information about our region and help them make the best decision of their lives to come and work and do business here. On the welcome and integration side, we have a healthcare kind of welcome concierge program, which is predominantly delivered by Stephanie. She does a get to know you virtual call before somebody moves to the region and gets to know their family, what their needs are for recreation, what their needs are for employment, where we can also connect them with partners like Working NB. And we kind of just get to know them and we're their first friends. When they come, we provide them with a welcome basket of, locally selected goods from Miramichi small businesses and home operators, and provide those in a basket to welcome them to the region. Stephanie also checks in with them at 2 months, 6 months, and 12 months with face-to-face touch points to see if there's anything that they're missing, that they need, or things they'd like to share with us about how their settling in has gone. We also discover during those touch points that early red flags that might indicate they are having difficulty settling in and may be looking elsewhere. So that retention piece. It's essentially settlement support, resources, networking, connecting. These individuals often are finding there's 3 red flags that are coming out of these meetings currently, and that's spousal employment, child care for their children so that they're able to have both partners work, and also creating friendships and social networks within the community. They're feeling a little isolated. So those are the 3 red flags that we are currently seeing in our meetings with the professionals we've been supporting. We also do orientation tours and site visits of the region so that individuals can get an idea of what's available to them, the services, the recreational sites, early on in their settlement without having to kind of find them on their own. We also have an annual appreciation event to show our thanks and appreciation to the healthcare professionals that have been contributing to the economy of the region for a long time, and to also welcome all of the healthcare professionals that have chosen to live and work in the region in the last 12 months. And we have a Health Pro Buddy program, as we're calling it, whereas it's basically a mentorship program or a matchmaking of sorts between a new physician family and a physician family that's been here for a while, so that they can help each other with maybe issues that are specific to that dynamic. And we also organize welcome dinners for new physicians and try to connect them with individuals that would maybe be that start of a social network. We've also, through the work, collaborative work with our Community Advisory Committee, which is made up of several physicians, talent acquisition of Horizon, recruiters from Department of Health, educators from DalMed, a variety of people volunteer their time on our community advisory panel, and we thank them very much, and they have contributed to these great ideas which we have been able to put in place. One is a med school mentorship program where 4 students a year are sponsored to go through a coaching program to help them study for and sit the medical school exam. as well as passing interviews that are part of that process, and a lot of other coaching towards things that are quite specific to getting into med school, or writing their credentialing exam if they were foreign trained and allowing them to open up their practice locally. We have a fourth-year med school scholarship, and this is awarded to a student who has the intention to specialize in family medicine. They would be in their fourth year of medical school, making their selection to go into family medicine, and they sign a one-year contract which basically says that they'll come and practice in the Greater Miramichi region for 1 year after they finish their credentialing and they're ready to practice. And if they don't, they would be required to repay the scholarship funds that they receive. Family medicine residency launched in July 2024, and it is 2 positions. We currently have 2 residents, which is a fantastic opportunity to have people come settle in our community, finish their learning on being a family physician, and hopefully stay and do their clinical practice here. We also have LICD learning positions. We have 4 annually, which is done through Dal Med, and their third-year med school students who are here typically a year, going through different departments of training. And those clerkships positions are another great opportunity to show medical learners early on in their medical career of how great it could be to live and practice in the Greater Miramichi. So, Greater Miramichi, how's she going? Here's an update on our achievements and milestones. Since September 2023, we've supported 16 nurses, 1 physician, 1 physiotherapist, and 4 clerkship students, as well as 2 family medicine residents, 2 med school mentees, 1 family med scholarship recipient. And congratulations to Robert Logie, who is the very first Greater Miramichi scholarship recipient for this new program that we hope is very successful in creating Greater Miramichi family physicians. We celebrated with 85 attendees at our healthcare homecoming in July 2024. And now for the grand finale, we will share with you 2 videos. They're both 2 minutes long. They're different versions of each other, featuring different parts of the region as highlights, and both have kind of a different vibe to them. So we hope you enjoy them, and thank you so much for your interest in this presentation. Thanks for working together for our communities.
My commute to get to work in the morning is 2 minutes flat. You won't get that in those big cities. It's got that, small town feel, but all the amenities that you really need.
What I love about living in Miramichi and working here is the fact that we have a really good work-life balance. I'm going back to school to become a nurse practitioner, and my managers are very supportive of that.
There's something about just this size of a community and hospital where it just feels just right. I've been supported through my growth as a physio. You don't feel like a number, you feel like a person.
Our ophthalmology center has 2 operating rooms. To be here and to be given the opportunity to open the center, and I think it is a unique place.
I'm a physiotherapist at the Miramichi Regional Hospital. People are very friendly here. I feel like I collaborate a lot more with the rest of the healthcare team since I've been here.
I spend a lot of time with my family outdoors, and we love to have picnics at Fritchie's Wharf. We love to go for a walk along the waterfront.
The Miramichi River is a huge draw. If you have any sort of inkling that fishing is something that you'd like to partake in and raise your kids around a giant body of water, well, Miramichi has it in spades.
The easy qualities of the Miramichi really allow me to live a little bit more in the present and have more time with my family and friends and to do the things that I really enjoy.
I always have my skis in my truck at all times. And after work, within 10 minutes, you're here at the ski club.
We see the benefits here, even in the winter. Winter here is beautiful. We love it.
We feel the inclusivity that Miramichi offers.
My commute to get to work in the morning is 2 minutes flat. You won't get that in those big cities. It's got that, small town feel, but all the amenities that you really need.
What I love about living and working here is the fact that we have a really good work-life balance. I'm going back to school to become a nurse practitioner, and my managers are very supportive of that.
There's something about just this size of a community where it just feels just right. I've been supported through my growth as a physio. You don't feel like a number, you feel like a person.
I'm a physiotherapist. People are very friendly here. I feel like I collaborate a lot more with the rest of the healthcare team since I've been here.
The Miramichi River is a huge draw. If you have any sort of inkling that, fishing is something that you'd like to partake in and raise your kids around a giant body of water, well, Miramichi has it in spades.
The easy qualities of the Miramichi really allow me to live a little bit more in the present and have more time with my family and friends and to do the things that I really enjoy.
I always have my skis in my truck at all times. It's so nice to get out and away and the fresh air, and you get on the trail and you go.
We see the benefits here, even in the winter. Winter here is beautiful. We love it.